Hi, Dr. Dillon. I decided to try to do this today, so excuse the dress, but this is my mom. I'm going to be assessing her, Ellie. So we're going to begin. Hi, Ellie. I'm here to do your well visit.
Okay.
First, let me wash my hands. If there at any point you feel uncomfortable, there's any areas of pain or tenderness, just let me know along the way.
Gotcha.
Okay. So first, we're going to begin by inspecting the head, palpating any areas of tenderness.
Nope.
Symmetrical, normal cephalic, midline. Don't feel anything. Hair's evenly distributed. Okay, and then I want to feel for some lymph nodes. Occipital back here. Post-auricular. Pre-auricular. I'm just going to do some of the deep cervical ones. Anterior cervicals. I'm just doing some of the supraspinatus ones too while I'm here. And then I'll hit the infraspinatus ones when I do the breast exam. Moving on to the tonsillar. And then the submandibular. Everything feels good. And the submental. Great. And then I'm going to palpate for your carotid. That's good. Strong. Good. And I'm going to listen for any carotid broes since we're here. This is a pressure sensitive one, just so you know, just like yours. Good. Okay, good. No brows auscultated. So far, so good. So feeling for the temporal artery. Okay. That's good. Okay, great. And then I just want to check. Tell me if you feel this.
Yes. Yes. Yes.
Good. Okay, so that was just checking for part of the fifth cranial nerve. So next we're going to move on to the eyes, I guess. Actually, no, sorry, Pat. Let me just keep doing the neck. Can you push your head against here? Good. Push your head against here. Turn it. Can you turn it this way towards my hand? Thank you. Good. Let's try this one again. Good. And then can you extend your neck? Like that? Yep. And flex down. Great. Okay, now just looking straight. Can you swallow? Okay, we're going to check for the thyroid. So, helping turn your head to the right a bit. Swallow. Good. Okay. And turn your head to the left a bit. Swallow. Great. Don't feel any enlargements, no areas of tenderness. Okay, now moving on to the eyes. Yeah, we'll check that. So she has had LASIK surgery in the past. And you said sometimes you wear glasses for near vision, right? Age-related presbyopia.
Yes.
Okay, so we're going to give this a shot. Can you cover one eye and tell me the farthest line you can read?
E, C, T, P, N, L.
Great, that's 20/20. And then cover the other eye.
E, C, T, P, N, L.
Great, okay. And then just checking near vision as best you can. Can you try?
NUR 616 Practicum Exam Performance Checklist.
Good. Her vision's better than mine, Pat. Okay, great. So now, checking your eyes a little bit more. Cover one eye. I'm going to check your peripheral vision. Tell me when you see it.
See it. See it. See it.
Okay, checking your other eye.
See it.
Sorry, Pat.
See it. See it. See it.
Okay, good. Cover your eye again. Pick an eye. And just following my fingers, not your head. Okay, and then cover the other eye. Good. Okay, and then follow it in with this. Good. So there's a combination. And I'm going to check your pupils. Good. Constricts. I'm going to check again for consensual for the other one. Good. And then here. Great. Constricts and then consensual. Good. And let me see your eyes, just looking at me. I see the twinkle in your eye with an ophthalmoscope. If I had one, I would look and hopefully see a red light reflex. So everything looks great with your eyes. While I'm thinking of it, can you smile for me? Frown. Yeah, or be mad. Puff out your cheeks. Okay, so her 7th cranial nerve is intact also. If I had an otoscope to check her nose, I would see that the mucous membranes inside are pink and moist. Can you breathe through?
Yep. Yep.
Okay, I'm going to try with some scents. So keeping your eyes closed. Tell me what you smell.
Vanilla.
Great. I'm going to try one more scent. Their nose.
Cinnamon.
Okay.
Ooh.
Good?
Yeah.
Okay. I'm going to check your mouth and then we'll go over to ears afterwards. So first smile. Let's see your teeth. Good. Good occlusion. Open up. Let's see. Your mucous membranes are moist and pink. Dentition looks good. Say ah.
Ah.
Okay. Symmetrical rise and fall of the uvula. Hard palate. Lift your tongue up. Good. Move your tongue. Push your tongue into your cheek. Other side. Good. Can you bite down? Okay. And bite down. So if I wanted to gag her, check in the 9th and 10th, I could put that back a little bit more and that would gag her. And as she bit down, that also checked the motor sensation of the 5th cranial nerve, which looks like it's intact. So everything for your mouth looks good. Now we are going to do a little bit of hearing stuff. So I'm going to have you cover one ear and I'm going to whisper something in the other.
Sixers.
Okay. And move it over here.
Eagles.
Okay. Good. So she passed the whisper test. Now I want you to tell me if you feel this or if you hear this. Hear it? Okay. So I'm going to do this again and tell me when you don't hear it anymore.
About now. Okay.
Okay, so her air conduction is greater than bone on that side. Same thing here.
Okay. Okay.
Okay, good. So her hearing seems like it's great thus far. If I had an otoscope, again, I palpated the helix, tragus, mastoid, cartilages, soft and non-tender, pulling the ear back and looking in. Her tympanic membrane's intact and it's pearly gray. Same thing on the other side. So her hearing is great. Now we're going to move on to some musculoskeletal stuff, some different sensation tests. So can you contract that muscle? Good. Her muscle tone is good. Wow. Okay. And then go like this and push. Good. Pull. Push against me. Okay. Good. Can you go like this? Good. And the other way? Okay. Can you do the scrunch? Yeah. So her range of motion is great. Okay, and with your fingers, go like this, adduct, adduct, supinate, pronate. Can you go? Okay, good, 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 good. Okay, you got all the range of motion down. That's great. Okay, now I'm gonna do some of the tests for sensory. Before I forget, with your eyes closed, I'm going to put something in your hand. I want you to tell me what it is.
Eraser.
Okay. And one more thing.
Coin.
Okay. And now I'm going to write something in your hand. Tell me what I'm writing.
S.
Okay. And on this hand.
T.
Good. And I'm going to do the other thing on this side too.
Oh.
Sorry, stereognosis.
Eraser. Coin.
Good. Good, good, good. Okay, so we did them. Okay, now this is soft, so you can open your eyes for the moment. And this is sharp.
Yeah.
Okay, so tell me which you feel.
Soft. Sharp. Soft. Sharp.
Okay, I'm going to do the other side.
Soft. Sharp. Soft.
Good. Okay, now this is a little tricky, but tell me if you feel 1 or 2 points.
1, 2. 1, 2.
Okay, let me see your hand.
2.
Good.
1,
Okay.
2. 1. 1, 2. 1.
Okay, not too bad. Tell me if you feel this. I'm going to put this on one of your fingers.
Yes. No.
Okay. Tell me if you feel it and then when it stops.
Okay. No.
Okay. Now closing your eyes, tell me if I'm moving your finger up or down.
Up. Down. Up. Down.
Good. Okay, and then I'm going to do those on your legs too, just so we get those tests done also. So tell me if you feel soft versus sharp.
Soft. Sharp. Soft. Sharp.
Good. Other foot, leg.
Soft. Sharp. Soft. Sharp.
Okay. Now I'm going to do the 2-point one.
2. 1. 2.
Okay. Other leg.
2. 1. 2.
Okay. Now still with your eyes closed before I forget. I'm going to point to 2 places on your legs. I want you to then point to where I pointed. Okay.
With my eyes closed.
Yeah. Point to where I did. Good. Okay, I'm going to do it to your arms real fast since we're here. Point to where I pointed. Yeah? Good. Okay, great. Now I'm going to do this to your foot. Tell me when it stops, if you feel it and when it stops.
Okay. Stop.
Okay.
Okay. Stop.
Okay. Am I going up or down?
Down. Up.
Okay. Still with your eyes closed. Down
Up.
or up? Okay.
Down.
Good. Okay. So we did a good chunk of those tests. My goodness. So now I'm going to start to move on to your lungs. So looking at your chest from the front, I'm going to percuss. Good. Just laterally. I'll probably get this again when she lays down, Pat, for the lateral. Okay, good. And I'm going to take a listen anteriorly. Just take some deep breaths in. Good. 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 And then a little bit laterally here. Okay. And her chest looks good. Everything looks symmetrical. She has equal breath sounds, and everything sounds clear. Can you put your hands up like this and then push down on your hips? So for checking for breast exam, you would look for any retractions, any masses would pop out. And I'll continue that when I do the breast exam. Okay, great. So I'm gonna feel for the areas on your chest, the precordium area. You can just relax. I'm gonna be feeling. Okay, so right here, we go down 2 intercostal spaces. Over to the left would be the aortic site. You can open your eyes. Walk your hands over. It would be the pulmonic site. And then going down 3, 4, 5. Right here would be the tricuspid. And then over here would be the point of maximal impulse. And from what I can feel, which is tough, as you said is right for women, it does feel like it's about 2 centimeters. So feeling for any heaves at the tricuspid or the left lateral sternal border. And there. And there. So I don't feel anything. And then listening at those sites. Remember this, again, it's heavy light pressure. Good. 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 And then while I have you here, I'm just going to have you lean for a little bit, and I'm going to listen at the left lateral sternal border. Sometimes we do this for patients who have COPD or who are obese. It just makes it easier to hear. Great. And right now, everything sounds good. So I'm going to just palpate your pulses on your arm before I forget, and then I'll move posteriorly for your chest. Okay, she's got good pulses there. Moving down. Okay, and then the other side. Good, you can relax. Good. Good. Okay, now I'm going to move on to the posterior aspect of the chest wall. If you can just turn a little bit, that way she can kind of see a little bit. So everything from what I can see here looks good. Everything looks symmetrical. She has good muscle tone. Taking a deep breath in. She has equal excursion. And actually, while I think of it, let me get my pen and my ruler. Okay.
I can put my leg up. Is that good?
That's good. Can you just say 99?
99.
Keep
99.
Good.
99. 99. 99.
Good. Okay, so she has even tactile firmness. And now I'm going to take a quick listen to all of her lung fields. Deep breaths in and out. Okay, and then this last time, take a deep breath in and then let it out. And let it out and hold your breath. Okay, actually, sorry, that's actually for percussion. So you can keep breathing. I'll get to that in a second. I'm gonna say, I want you to say a couple things. I'm gonna take a listen. Can you say 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Can you say A or E, E,
E, E, E. E, E, E. E, E, E. E, E, E.
E? Okay. And then can you whisper 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great. Okay, so she definitely doesn't have pneumonia. Now I'm going to percuss, and then we'll get to measuring for diaphragmatic excursion. Okay. So now I want you to take a deep breath in and then blow it out. Okay, now take a deep breath in and hold it. Okay. Okay, so that looks like it's about 3 centimeters. I want to check that on the other side. Yeah, you can breathe, sorry. Okay, take a deep breath in and then blow it out. Okay, now take a deep breath in again, just breathe. Okay, hold it. Okay, good, and that's the same on the other side. Okay, so everything looks good lung-wise. So now we're gonna move on, and I'm gonna move some of this stuff so you can lay down so we can get to listen to your stomach and do some things down there before we tackle some other things. Okay, yeah, we don't need any of that stuff. Okay, so for the breast exam, what I would do, thank you. Actually gonna need this. Yeah, you can put your arm just like this. Okay, so palpating for the super cervical lymph nodes, infracervical lymph nodes, and then the central would be way up. The posterior, anterior, and then the lateral are here, and the epitrochlear are here. And then for the actual breast exam itself, you would want to do light, medium, deep palpation. And I would do it in a circular motion all around the area, and then squeeze the nipple to see if there's any discharge. And she seems good, and we're going to go with that. Looking at her abdomen, everything looks okay. Doesn't see any visible masses. I'm just going to take a quick listen before I palpate. And actually, before I do the abdomen, while we're here, I'm going to listen for aortic, renal, iliac, femoral bruits. Okay, so no Broe's auscultated, so now I'm going to listen to her bowel sounds. Great. She has bowel sounds in all 4 quadrants. I'm just going to palpate lightly. So I realize that she is petite. Me personally, I have a hard time feeling for this aorta, but that is where I would check. That's where I would check. I don't feel it, but that's where I would check. So everything feels okay here. Everything's non-tender. And then percussing. So everything's normal there. And then for the liver, right mid-clavicular line going up. Looks like right there. About, and then coming down. Okay, and that's about 6 centimeters. So that's the liver. So now I am going to percuss for her spleen while she's lying. So if I can have you turn towards the camera a little bit. Okay, and on the lateral side, it would be somewhere between the 9th and 10th rib. For dullness, we take a deep breath in. So like right around there. Okay, good. And then while I have you lying, if you can just ever so slightly shift a little bit to your left, not completely, just so that way she can see, but it'll be left lateral recumbent, listening for S3, S4 on that side. It would be at the apex of the heart. And thankfully, she doesn't have any S3, S4 sounds that I can hear. Okay, so I think that's pretty much everything GI-wise. So now with your legs, we're just going to do a little bit of range of motion, up, down, okay, internal, external, good, and then up, down, internal, external, good. Can you push against me? Good, okay. Point your feet, put your foot there, good. Pull it up, good. Same thing, push against me. Okay. Point your foot. Okay, can you point your foot? Okay, good. So everything looks good there. You can sit up. You can sit up. I'm going to keep doing some of those tests. If you want to swing forward, I have to check a couple more things here. Okay, so can you point your feet again? And then can you dorsiflex them, flex them? Great. So I'm going to check for her Babinski or her plantar on the right foot. Negative. And that's also negative. So that's good. Okay, we're going to check your reflexes real fast for your arms, and then we'll go to your legs. We actually had some luck doing this when we practiced. Good. And then just let your arm dangle a bit. The triceps. Sorry. Okay. Good. Good. And then I'm going to check on this side. Good. And then just let your arm dangle. Good. And then down here. Okay, and then I'm going to check her patellar one. Good. Good. I'm going to check the Achilles. Okay. Great. While I'm down here, I'm going to check her pulses below. Pedal. I'm checking her pedal. Versalis pedis. Okay, her posterior tib, right foot, good, and post tib on the left, and then checking her popliteal bones. Good. Good. Okay. Let's see. Okay, so I'm gonna have you stand, and can you do your heel to your shin? Yeah, and push it down. Okay. Can you facing down? Yeah, that way she can see. Can you squat down a little bit? Good. Can you stand on one leg? Can you stand on the other leg? Can you hop on one foot? Good. Okay. Okay. Are you able to walk heel toe across? She is. Okay, come back. Can you walk on your tippy toes? Okay, good. Okay, and then holding your arms out with your eyes closed. Yep. Okay, good. So no pronate or drift. Okay, you're good. Can you go like this? And this. Yeah, and then extend your hip back. Yep. Extension. Okay, and then over here, turn around. Look, woohoo! Before we get to the spine. Facing her. Okay, there you go. Okay, standing like that, and then close your eyes. Okay, so Romberg's good. Okay, you want to do your spine. Yeah, so you can go this way, other way, move forward. Okay, extend it, back. Okay, well, while you're there, you can go forward. I don't see any scoliosis while she's forward. Okay, now you can go back. Okay, you're good. Good. Okay, turn around. Okay, so I think that's everything that I can think of, Pat. I might have left one or two things out, but I don't think so. Her muscle tone's good. We did all of the cranial nerves, hearing, we did balance. I think that's it. So hopefully that's good. I get an A, and I can move on to the next class. Okay, thank you. Bye.